Good morning, dears. Today we are going to discuss about the treatment and management plan of IBS. Treatment and management of IBS. As you know, it's a very chronic, irritable, inflammatory, lifelong disorder with a wide range of symptoms, with a wide range of duration and severity. So, naturally, the treatment depends on the predominance of the symptom in our patients, then considering the type of personality of our patient, and as you know, most of our patient may having mostly the same set of symptoms with varying in severity. So, we have to evaluate the cause of IBS in each and every patient, because as in so many cases, no two individuals are alike with IBS. So, we have to find out as far as possible the cause of IBS in each patient. Next about the management plan of IBS for all patients. Number one management plan is to modify the lifestyle modification. Lifestyle modification. Whatever may be the PC, number one lifestyle modification has to be implemented with a food style modification, then bowel style modification, and lastly, regarding the sleep style modification. That means we have to advise our patient to have a regular food habit, regular bowel habits, and regular sleep habits. So, food style modification, mind style modification, sleep style modification, etc. plays great importance in all patients of IBS. Like that, avoiding triggers, especially with dietary changes. As you know, one of the most common cause of most triggering cause of IBS may be a dietary factor. So, dietary changes are very, very essential. Then avoiding other triggers, and being a very chronic disease, continuous care is very, very essential. So we have to advise our patient to have a regular meals, taking time to eat, then limit high fatty food with a good fluid intake, with a limited fizzy drinks and coffee. We have to advise our patient to have maintain a very good fluid intake habit. They can have 1 glass or 300 ml of water with an interval of 1 hour, and thereby they can maintain the fluidity of their blood, and advise them to limit sugar-free sweets and sorbitol, and limit the fruits to 3 portions per day. And one of the most important symptom of our patient regarding the IBS is complaint of gas or flatulence, or alternate diarrhea or constipation. In such patients, we have to advise our patients to limit their diet, especially in low in FODMAPs. These are the food substances which contain high amount of fermentine, oligo, disaccharides, and monosaccharides, and polyols, etc. By limiting such FODMAPs food, they can minimize the GIT complaints, because all these FODMAPs are poorly absorbed and highly fermentable short chain carbohydrates, which results in gas production, increased luminal fluid content, and distension and peristalsis. That is why in patient with IBS, after having with the high amount of FODMAPs, that will aggravate their condition. Let us see which are the food considered as FODMAPs. FODMAPs means the food which cause high degree of fermentation with a low absorption of oligo or di or monosaccharides food. High FODMAPs with fructose. These are apples, pears, honey, fruit juice, dried fruits, corn syrup, and water lemon. This contain high amount of fructose, and low amount of fructose are citrus fruits, then berries, bananas, grapes, honey, kiwi, etc. Polyols are sugars of stone fruits, then avocados, mushrooms, and cauliflower. Lactose contain food are milk and milk products, then yogurt and soft cheese. Then Fructose and galactans are wheat type. Wheat, rye, then garlic, then onions, then asparagus, leeks, legumes, lentils, cabbage and sprouts. Lower food maps again with rice, corn, potato, lettuce, then spinach, cucumber, green beans, then tomato, etc. So, as far as possible, we have to avoid our patient with or limit their intake of FODMAPs like these things. And it is better to have the food which are fish, green vegetables, non-citrus fruits, then brown bread, yogurt, cereals, pista, bran, bananas, etc. can be included, or those foods may helpful to our patient with IBS. And at the same time, we have to avoid some specific food more than that of the general food maps. We have to advise our patient specifically to avoid spicy, fatty, oily, fried foods with citrus fruits, then cheese, then onions and chocolates, nuts, beef, white bread, eggs and dairy products. So by managing the inclusion and exclusion of food, that will help in a very good manner. And another one thing is, we have to advise our patient to have their food at regular intervals. And regular interval means, if our patient is having a food habit of 8 a.m., then 11 a.m. or 12 a.m., 4 p.m., then 7 p.m., something like that, they have to have the food at a regular time on every day. And as far as possible, the food should be taken with a low quantity or a split and divided dose at least 5 or 6 times per day. And they have to maintain, or they have to limit their caloric demand, caloric inclusion, a maximum of 1800 to 2000 calories per day. Of that food, the carbohydrate can be up to 350 400 grams, and total fat should be limit up to 20 grams, and proteins can be a maximum of 50 to 70 grams. That means 1 gram of protein per day, and calcium near about 600 milligrams, then sodium 1000 milligrams, and iron 17 milligrams. By that, a diet chart can be maintained. And in patient with abdominal pain, constipation and diarrhea, in such condition, we can advise our patient to increase their dietary fiber and avoid laxatives. Then regarding the mind style management, in all patients, we have to give a great reassurance and emotional support, especially from teachers or from parents or from family members. If it is not enough, we can have an advice from a professional counselor, then family support, we can have the advice from a very good qualified dietitian and healthcare team. Then stress reduction and avoidance of tranquilizers and antidepressants, etc. plays great important role. And we have to maintain the very regular food habit, bowel habits, then sleep habits, then fluid habits or food habits, etc. that will support, that will help and support our patient to manage a IBS case. And next about the homeopathic management of irritable bowel syndrome, and I think that can be studied in another class. Thank you for watching.